Hello, you're very welcome to HIPE, Hospital Inpatient Inquiry, and to Clinical Coding. This brief introduction is not intended to replace the formal training that you will receive in the Healthcare Pricing Office. Rather, the purpose of this presentation is just to give you an overview of what HIPE and Clinical Coding are and to familiarise you with some of the tools used by HIPE as you commence in your new role as a clinical coder. By the end of this presentation, you will know what HIPE is and why HIPE data is collected. You will be familiar with the work of HIPE at hospital and national level and have an understanding of the data collection process, and you will know what clinical coding is. You will also understand the role of the clinical coder and be familiar with the tools used by clinical coders and have an understanding of the Clinical Coder Education Programme. By now, you should have received your HIPE Starter Pack. We will be exploring some of the contents of the pack during this session. Accompanying the presentation is a short questions and answer sheet, which you will be required to complete following the presentation and send to the HIPE Training Department. We have also included an evaluation sheet, and we would be very grateful if you could complete this afterwards and return it to us as soon as possible. Your feedback is very important, as it allows us to measure the effectiveness of the presentation and to develop and improve in future training. If you require any of the above items, please contact us in the HPO and we will ensure that they are dispatched to you as soon as possible.
Let's take a look at what's contained in your starter pack. Firstly, the 12th edition pre-course information and essential reading for beginners. You're required to read this prior to attending the first session of your formal training, which will be the introduction to HIPE 1. There are some exercises at the back of this workbook which can be completed with the assistance of your mentor or supervisor. Then we have the medical terminology and anatomy and physiology workbook. This contains lots of useful information on medical terminology and the abbreviations used in medical records, along with some basic anatomy and physiology information. We have included the latest edition of the HIPE Instruction Manual, a copy of the most recent Irish coding standards, an overview of the Clinical Coder Education Programme. This document describes all the courses you are expected to participate in as part of your training, the latest HIPE training calendar, which highlights upcoming training dates, the HIPE information brochure, the HIPE summary sheet, the summary of the patient's journey in clinical coding, and the 5 steps to quality coding. This is a document you'll become very familiar with during your training. We have the alpha characters used in the ICD-10-AM disease codes, a copy of the most recent issue of coding notes, and finally the HIPE Clinical Coder Education Programme Declaration Form. Keep this folder safe and take time to familiarise yourself with the contents. As I previously mentioned, we'll be referring to these documents throughout your training. A letter of introduction will have accompanied the starter pack, and there are further exercises attached to this for you to complete. Once you have finished going through the pack and completed all the exercises, your mentor or line manager will complete the HIPE Clinical Coder Education Programme Declaration Form and forward it to us in the HPO for our records.
The Healthcare Pricing Office is part of the Health Service Executive, and it's located on the first floor of the Brunel building in Houston South Quarter. It's just across the road from Houston Station and a short walk from Dr. Stephen's Hospital. Contact details for the HPO and HIPE support can be found on page 1 of the HIPE Instruction Manual, which is contained in your starter pack. The Healthcare Pricing Office, HPO, plays a central role in providing leadership for and management of ABF, activity-based funding. This is a funding model for hospital care for inpatient and day case services, which uses the data collected by HIPE to calculate inpatient and day case activity. You will hear more about ABF later on in your training. The HPO is responsible for a range of central ABF functions. Services provided by the team include HIPE, developing the annual price list for hospital services, supporting hospitals, hospital groups and regional health bodies to use their own ABF data to better understand activity and opportunities for improvement, and the development of classifications and price setting capabilities for other care streams including outpatient care, emergency care and for costing community health care. The team also consults with clinicians, system managers and other stakeholders across the hospital system and manages oversight and specialist reference groups. They are responsible for ongoing development and maintenance of costing standards and audit against the standards, along with speciality and patient level costing for price setting, including development of patient level costing software. And finally, it also manages the National Perinatal Reporting System, NPRS, which collects national statistics on perinatal events. The Healthcare Pricing Office oversees the administration and management of the HIPE scheme, including ongoing development of the HIPE classification system and coding standards, training and support of clinical coders, ensuring the quality of coded data, development and support of HIPE data collection and reporting software, and the provision of HIPE data and statistics to a variety of agencies. In essence, in relation to HIPE and the NPRS, the HPO is responsible for the collection of timely and accurate hospital activity data on behalf of the HSE. There are approximately 56 hospitals participating in HIPE in Ireland, around 300 clinical coders who capture over 1.7 million inpatient and day case discharges annually. Over 99% of all discharges are included in the national file each year. So what is HIPE data? Hospital Inpatient Inquiry is activity data on inpatient and day patient activity from participating hospitals. HIPE does not collect information on A&E, outpatient activity, clinics or well babies. It also does not collect information on virtual wards and discharge lounges or elective admissions to acute medical or surgical assessment units. Data from these areas is captured by other means. Full details regarding the type of activity captured and not captured by HIPE are available on page 15 of the Irish Coding Standards, which is contained in your starter pack. The HIPE discharge record is created when a patient is discharged from or dies in hospital. By the time of discharge, all the information pertaining to that admission should have been captured and completed. This record contains all the administrative, demographic and clinical information for a discrete episode of care. What is a discrete episode of care? An episode of care begins at admission to hospital and ends at discharge from or death in that hospital. So what happens during the episode of care? Let's take a look at the patient's journey through the episode of care. At the beginning of the episode, the patient is admitted to hospital, either as an inpatient or as a day case. They are seen by clinicians who diagnose and treat the patient. Throughout the episode, the patient may be seen by many different clinical staff and may have interventions or procedures performed, all of which will be documented in the patient's medical record. Once the patient treatment is finished, they are discharged and the episode of care is completed. Now let's follow the HIPE data collection process. At the end of the episode of care, when a patient is being discharged from hospital, the clinicians fill out a discharge form and the clinical information for that episode is completed. The discharge details get entered into the patient management system. Your hospital may use IPIMS or PAS or even a bespoke patient management system. These details from the patient management system are downloaded into the HIPE portal and become a HIPE record. The clinical coder extracts the information from the patient's medical record, translates the clinical details into code using the ICD-10-AM ACHI ACS classification books, and enters it onto the HIPE record. All HIPE records need to be coded within 1 month of discharge in order to comply with HPO requirements. On the 3rd working day of each month, all the completed HIPE records are exported to the HPO, where they are entered onto the national HIPE file. This data is run through a series of quality checks before it is released for local, national and international reporting. We will explore and explain all these steps in greater detail during formal training. HIPE data is a very valuable tool for hospitals, the HSE, the Department of Health and many other agencies. But in order for the tool to be effective, it is imperative that the data be accurate, uniform and timely. To ensure this, the quality of the data collected is checked, assessed and audited at many stages prior to being released for use. The first stage checks take place at hospital level. When entering data onto the portal, edit checks flash up to remind the coder to check coded details or to alert the coder to inappropriate codes. The edit checks that are applied to a new coder account are at a much more stringent level than that for experienced coders. While this may be frustrating, it is an important part of training, and once your line manager is satisfied with your coding ability, the edit checks are relaxed. The portal checker highlights anomalies in the demographic, administrative and clinical data. This gets run regularly in the department, and errors should be amended prior to the data being exported to the HPO. The HCAT is an audit tool used by HIPE managers and senior coders to assess coded data at a local level. The PIC is an external tool that will also run a check on coded data before export. Your line manager will organise a logon and password for you, and you will receive some training in the use of this tool. Again, errors highlighted by the PIC need to be amended before export. Finally, the HPO data quality team carry out a series of audits and checks on submitted data. They may send queries on cases to your department for correction or clarification on occasion. These queries need to be addressed, resolved and returned to the HPO as soon as possible. The HIPE data collected by clinical coders is used for a number of applications, including activity-based funding, parliamentary questions, WHO and OECD statistics, service planning and bed capacity studies. It's also used for the measurement of hospital workloads, measuring quality, clinical audit and investigation, and health technology assessment. It provides data on health policies, supports for research and epidemiological studies, and gives input to population health profiles. National HIPE statistics are available on request from the Healthcare Pricing Office, but hospitals also report on their own data through reporting functions on the HIPE portal. Here is a definition of the clinical coder. The clinical coder, the person who translates clinical concepts into clinical codes, performs an essential function in providing quality, accurate and uniform medical information and greatly contributes to the continuous growth of medical knowledge. Simply put, the clinical coder translates the medical terminology as written by the clinician to describe the patient's complaint, problem, diagnosis, treatment or reason for admission to hospital into a coded format which is recognised both nationally and internationally. Working with you throughout your training, we will teach you the skills that are needed not only to understand the medical terminology, but how to turn the relevant medical information taken from the patient's medical records into quality, accurate codes. Further clinical coder duties include respecting patient confidentiality. This is of the utmost importance. You'll be privy to very sensitive patient information, and it's vital that confidentiality is maintained at all times. Coders work to meet monthly export deadlines, ensuring timely and accurate coding of all discharges. They liaise with clinicians and other medical personnel to clarify information and ensure quality documentation. They also liaise with personnel from IT, finance, hospital management and medical records to ensure that all systems run smoothly, all information is up to date, and that chart flow to the department is maintained. Coders are also responsible for running in-hospital reports from HIPE for clinical staff, hospital management, etc. This is usually carried out by senior coders, but you will receive instruction on HIPE reporting during your training. All coders participate in ongoing training. In order to be an effective coder, it is vital that you keep your medical and coding knowledge fresh and up to date. This list is by no means exhaustive. The role of the clinical coder can vary depending on the requirements of your hospital and those of the Healthcare Pricing Office. The tools of a clinical coder's trade. ICD-10 AM ACHI ACS classification books, the Irish coding standards, coding queries, the HIPE instruction manual, training courses, HIPE software, edits and reporter software, coding notes, checking list review of up to 200 cases, HIPE coding audit toolkit, otherwise known as the HCAT, checker programs, and routine data quality checks. These may look like a lot, but in conjunction with your hospital mentor and the training team here at the HPO, you will be brought through each element of HIPE during the clinical coder education programme. Some of these documents you will have already seen as they were sent out to you in your starter pack. Other tools are online or built into the HIPE portal.
To begin with, these are the tools you will use most as a clinical coder. The HIPE portal, the 12th edition classification books, International Classification of Diseases, 10th revision, Australian modification, the Australian Classification of Health Interventions, and the Australian Coding Standards, ICD-10 AM, ACHI, and ACS, and of course the Irish Coding Standards, the ICS. Your line manager will arrange for you to have a login and password for access to the HIPE portal. There is a set of 12th edition classification books in each HIPE department, and a copy of the Irish Coding Standard is delivered to every coder, and there is a copy in your starter pack. Both the 12th edition classification books and the Irish Coding Standards are available in electronic format, called the IE book. Again, your line manager will arrange a login and password access to this.
These are some examples of what the HIPE portal screens look like. You may have some experience of this in your hospital already. You will receive further training on the features of the HIPE portal in future sessions. Each field in the portal is populated with administrative, demographic and clinical data taken from the patient's medical record. As we progress through your training, you will learn how to populate each field appropriately. The HIPE instruction manual, included in your starter pack, contains information and guidelines to assist you in correctly populating fields in the HIPE portal. The clinical data collected by HIPE includes one principal diagnosis and up to 29 additional diagnoses, along with hospital-acquired diagnosis indicators. It can also collect one principal procedure or intervention and up to 19 additional procedures or interventions.
The classifications used by HIPE in Ireland are the 12th edition of the International Classification of Diseases, 10th revision, Australian modification, and the Australian Classification of Health Interventions, along with the Australian Coding Standards, otherwise known as the ICD-10 AM ACHI ACS 12th edition. The coder translates the medical terminology from the patient record into codes using the ICD-10 AM ACHI ACS 12th edition books. The disease classification is based on those used by the World Health Organization, the WHO, but have been modified to provide further specificity by the Australian Consortium for Classification Development, ACCD, thus the Australian modification element to the title. We use these codes along with the associated guidelines and standards, but we also have some additional guidelines and standards that are specific to coding in Ireland, which have been created by the HPO, and these are contained in the Irish Coding Standards, the ICS.
There should be a copy of the most recent edition of Coding Notes in your starter pack. Coding Notes is a quarterly newsletter published by the Healthcare Pricing Office and contains help and guidance on all aspects of HIPE, news about developments in HIPE, coding features, answers to some coding queries received by the HIPE department from coders, and information on upcoming courses. This is issued to each coder via email and is also uploaded to the hpo.ie website. Back issues of coding notes are also held on the HPO website. It is important that you read this newsletter carefully to keep up to date with changes and advancements in clinical coding. Performance Indicators for Coding Quality, or PIC, is an objective quality management audit tool for clinically coded data that identifies records in HIPE episodes that may be incorrectly coded, based on a set of predefined indicators. In Ireland, PIC is integrated with the HIPE portal to analyse 100% of all episodes submitted overnight. PIC generates reports based on an overnight import from the HIPE portal. Coders each have a login to PIC where they can view their reports on screen or download them. Access to PIC is dependent on access to HIPE. Therefore, only those that have HIPE access can have PIC access. Your HIPE manager will contact pic.hpo@hse.ie to request PIC access for you. It is recommended that users use Chrome to access PIC, otherwise the screens may not display properly. The HPO Metadata Service is the tool used by HIPE for the registration of new consultants and wards. This would normally be used by senior coders or coding managers, but you will receive a login and password for this also. HIPE coding is an ongoing training process. Even the most experienced of coders continue their training as we need to constantly review variables and update coding techniques. Coders can sign up online for all courses at www.hpo.ie. We are very lucky to have a professor in anatomy to deliver training sessions in anatomy and physiology. These courses are hugely important and participation is strongly recommended. The courses are especially important for familiarising yourself with medical terminology. Professor Lee's lectures have been pre-recorded and are available to view online. The links are available on request from the HIPE training team. For further information on the courses you are expected to participate in, please see the Clinical Coder Education Programme document in your starter pack. For further information on the Healthcare Pricing Office or HIPE, or to register for any upcoming HIPE training courses, please visit www.hpo.ie. The HIPE training team is always at hand to offer help and guidance to clinical coders. Please contact us at hype.training@hpo.ie if you have any queries or require our assistance. Before we go, I'd just like to remind you to please complete the accompanying evaluation form and return it to us at hype.training@hpo.ie. We are constantly revising and updating our materials, so your feedback is important to us, and we are very grateful for any suggestions to help us improve our training. Before we finish, I would like to take this opportunity to wish you all the best as you start in your new position as a clinical coder, and we look forward to meeting you in person in the future. Thank you for taking the time to view this presentation. Again, if you have any queries, please contact us on hype.training@hpo.ie.